Hi, so I wanted to do a quick video on how to measure your diastasis correctly. First thing I want you to do is download the tracker below so that you can mark down your results as you go. Now, what you will notice is that you are going to be getting 12 numbers. Now that is quite different from a lot of times how you've seen to measure diastasis. We are going to be measuring in 3 areas. So you're going to measure just below the sternum around here. So a few inches up from your belly button. You're going to be measuring just above your belly button, not inside the belly button, because that can be a pretty tender spot and have had a lot of damage anyway because it's a weakened point. So we want to measure just above the belly button, and you're going to measure below, a couple of inches below the belly button, just above the pubic bone. You are going to measure each area twice. We are looking to measure it when you are relaxed, so lifting your head without thinking. Then we are going to remeasure when you are engaged. So that means engaging your TVAs or lifting your head whilst you do a long exhale. So, which will should automatically pull up your pelvic floor and engage your TVAs. Now, you're going to also measure the width, and the width is done with your fingers this way. So you are going to be measuring, let me see if I can get this way. So how many finger widths can you go along between the 2 rectus abdominis muscles? And you're going to be measuring the depth. So how far can your fingers sink in? So is it at your fingertip? Is it a fingernail? Is it between the fingernail and the first knuckle, between the first knuckle and the second knuckle? And you're going to measure it like that. So you're going to get the width in fingers and the depth in measuring along or up your finger. So fingernail, knuckle, 1.5 knuckles, 2 knuckles, that measurement scale. Both engaged and relaxed. Now, one thing I want you to realize is the further you bring your head up, the more your rectus abdominis, so these 6-pack muscles here, will come together. So it is not a true representation of your diastasis if you lift your head and shoulders up too far off the ground because you're manually, because of how you're working your core, pulling these muscles together. The lower the head, the less tension on the external muscles. And that's what we want to do. We want to make it so that we've just activated our rectus abdominis muscles, because you need to activate it in order to find the sides of them and then measure at that point. All right, so come on, let's come down. So you're going to have your knees bent and just be relaxed. Now let's start up here. So just below our sternum. So my sternum's here and I come down, and I want you to push your fingers in and then lift the head. And what you're looking for is, did those rectus muscles wrap around your fingertips? And how far apart are they? And then how far can you go down? Then relax. Then come down to just above your belly button. Push in. Don't be scared to push in relatively far above your belly button. This is normally the worst part in most people. And then lift your head without thinking until you feel those rectus abdominis muscles wrap around your fingertips. Now, for some people, you may find that they don't wrap around and you're like, there's still a gap there. So in that case, start with more fingers inside. So 3 or 4, and then lift up. You may need to lift up further until you feel them wrap, and then come back down, letting more fingers come into the gap as you go out, and then measure when your head is just 1 to 2 inches off the ground. All right, now we're also remembering we're pressing into the depth. Some people I have found are like, I don't know what is extra fluff versus what is the depth. So what I want you to do with that is work out what the depth is to the side of your gap where you know you have muscle. So if you lift up and you push down and you're like, yep, I can get down a good half a fingernail or whatever happens to be, Then go into your gap and push down and see how far it goes. Then use the difference. So if you are half a fingernail down on the side and a knuckle in the gap, you're probably about half a knuckle in the gap, as that is what the gap is versus what is a little extra fluff. Now, when we go down, what we're looking for is where do we feel tension under our fingertips. So the tension you're looking for, it should feel like it's going to go in slightly, but it should feel like a trampoline base. So it should feel like there's tension. You push down and there's a little bit of tension and spring there. If it keeps sinking down, then that is a problem. That's what the diastasis is, and that means your core isn't functional, okay? So not squishy like, you know, what it is around with the fat. That still, I get through the fat and then there's tension there, okay? And that's what we're looking for in the gap. You get through the fat and then is there tension at that point? And that is what is functional. Then you're going to repeat from the pubic bone just up here and repeat the process, measuring the width and how far down you can go. And then you're going to repeat that process with engaging. So you're going to inhale, exhale, engage, and check. So for me, it's nice and firm all the way up, okay? Now, a couple of things to note. When you engage your TVAs, you may find that your gap is wider but less deep. So shallower but wider, and that is normal, and in fact, it is a good thing. So when you engage your TVAs, what that does is it pulls on that connective tissue, strengthening it and giving it tension. So just like in the rubber band, if you pull on it, then there's tension there, and that is what you're looking for, okay? So if your gap gets wider but it is shallower, that is a good thing. The width is much easier to fix than the tension, so keep working on getting more and more tension. Now, when you come back to do this, whether it be in 3 weeks or 4 weeks or 2 years down the track, your relaxed measurement may be the same as your engaged, because when you lift your head, you automatically engage your core correctly, and that is awesome, okay? So don't worry about that. That is where you want to be. Okay, I hope this helped, and let me know if you have any questions.